Welcome, everybody. It's my pleasure to welcome you all to this first of a series of 3 workshops on specific topics in the implementation of SAP-E. The aim of the workshop today is to share knowledge on how to build the momentum in the implementation and how others have succeeded in getting attention and support, and how to get support for national stroke plans, and how basically also to get a signature for the declaration. The importance of strong stroke support organizations cannot be overestimated. Scientific leaders and societies can recommend, but only patients and their representatives can demand. This is why the co-chair of SAP-E and director of SAFE, Arlene Wilkie, will share her thoughts on this with you. In the regional breakout sessions, we want you to share your successes and discuss your challenges. We further want you to give feedback on how the SAP-E Steering Committee, ESO and SAFE may further assist you in this process. The inputs from the groups will then be shared with all afterwards when we meet again. And with this introduction, it's my pleasure to give the word to Arlene Wilkie.
Just going to share my screen, if that's okay. Good morning, everybody. Actually, it's probably good afternoon for everybody. Good afternoon. I hope you can hear and I hope you can see my slides. Hannah, if there's any problems, please just shout and I will hear you. So I'm delighted to be here today to speak to you all about the how we're all doing in terms of implementing the Stroke Action Plan for Europe, across Europe. And I just thought we'd maybe just start with a quick reminder to us all. Why are we working on this again? What we're trying to do, of course, is we're trying to make sure that each country in Europe has a government that has committed to implementing a national stroke plan, to funding the stroke services in the plan, and then to audit those stroke services. And how will this help you in your work? Well, what we hope is that by getting all this done in your country, you will be able to see and highlight what stroke services perhaps are not meeting those standards that you have set in your plan. You will be able to work with local stroke professionals to identify what needs to be done to bring about improvements in services. You will be able to work with your health system makers, decision makers and planners to plan for recruitment and training of that stroke specialist workforce that is needed to implement those services. It will also help stroke support organisations work with their local public health systems, for example, to do campaigns along the lines of awareness of symptoms or how to reduce your risk of having a stroke. It will also help the stroke support organisations know what life after stroke support is needed and what they should be providing as stroke support organisations. Also, if you're able to compare yourself with other countries, this might highlight some issues in your countries that you might want to actually use in some of your campaigning. But most importantly, we're doing this because we want to make sure that it leads to better outcomes so that fewer people die from stroke and that more people will make a better and quicker recovery from the impact of their stroke. So what have we been doing? We've been reaching out to people to ask people what they've been doing and what successes they've had. And I'm going to share some of that with you in a few minutes. But first of all, you do know that at the end of last year and the beginning of this year, 2021, we held 3 information meetings for you. And SAFE also held 3 advocacy training sessions as well. I know many of you attended these meetings. And the purpose of these was to grow a community of national coordinators throughout Europe who wanted to implement the stroke action plan in their country. I am delighted to let you know that in the 52 countries where we could possibly be taking action, 48 of those countries have got named coordinators. And within those 48 countries, we've got 89 people named as coordinators. So it shows you that in some countries, it's not just one coordinator, there might be 2 or 3 supporting each other and being those named coordinators. And I think this is a fantastic success in less than a year that we've managed to get these people on board and to get people started working on this work. The other key piece of work that we focused on this year was about the declaration. And we launched this collectively on European Stroke Awareness Day this year. And the declaration, again, just as a reminder to us all, it summarises the aims of the implementation of the Stroke Action Plan for Europe. And by signing it, your government is signing up its country to support the implementation of the Stroke Action Plan in their country. So what's happened since European Stroke Awareness Day? There's some quite good news. We know that the declaration has been translated into 17 languages. So we are encouraging each of you in your different current countries to take the declaration and translate it. We know that in the Ukraine, Portugal and Lithuania, we have the declaration signed. We know that in Bulgaria, Estonia and Italy, they are progressing towards signing, which is fantastic. And I've also just received an email from Michelle, from Miguel, from Catalonia, just received this just a few minutes ago to tell us that on World Stroke Day, they should be signing their declaration as well. And they will be having a supporting press conference to let everyone know this is happening. So this is terrific news that across Europe, we are seeing this. Now, this is what we know so far. There may be many others out there who are also working on their declaration signing. Please let us know. Please let us know if you're interested in doing a translation. There's more work we can do with you on this. I also thought it would be interesting for you to know that not all countries are working on the declaration. Some are working in different ways. Ireland, for example, is about to publish its first national stroke strategy that will bring progress for acute services. Wales has published a quality statement for stroke, and this sets out what improvements they want to see happening in Wales. And the next step is to develop an implementation plan for this. And in England, we know that there is a stroke plan already in place. It is progressing. However, apparently the thrombolysis and thrombectomy rates have been decreasing slightly over and during the pandemic. So this is what we know just now. I'm sure many of you on today are doing so much more than I have described today, but I'd be really, really happy for you to share more information with me, because on the 19th of October, we have another meeting with a wider group of people, anyone who's interested in understanding a bit more about the Stroke Action Plan for Europe, and I'd really like to share with them much more information on what we have. So then your question next will be, how have they done this? How have people achieved their plans? So again, speaking to each of these organisations, I've got 4 slides that I just want to run through with you as some steps and some tips as to what these organisations have done to get to where they are at in their work on the Stroke Action Plan. First of all, there is the Stroke Action Plan for Europe website, and which has got a huge amount of information on there. But interestingly on there is a whole set of videos from some of the national coordinators who tell you what they're doing in their country and how they're going about doing it. I would recommend that you have a look at these videos if you're needing some inspiration just now, if you're wondering what to do next. I think some of these videos could be quite inspiring for you. And I would also ask anybody who's maybe done a video, if you want to update that video because you have progressed, please do let us know, and we can see how we can get these videos updated as well. So going on to the steps of how people have done it. The first step, as people will have done, is they have identified those key people that can help them implement the stroke action plan on a national level. Now, you may already have done this. I'd recommend it's something that you do on a regular basis. Some people may have turned you down. Some people may not have responded to your email. Continue this. Keep analysing and keep making sure you've got the right people on your group. Because what you want to do from that analysis is form a group or a committee. You can call it what you like. You could call it the National Stroke Action Plan for Europe Network. But what's important is who's in there. We need to make sure you have the clinicians from that whole pathway of care. So you've got the clinicians, administrators, different specialities, nurses, allied health professionals. It's so important that you have this cross section of people involved. As Hannah said, having patients and carers and stroke support organisations is also really important to ensure that you are truly speaking on behalf of those stroke survivors and that you're representing. Another thing to think about with stroke support organisations is that some of them, not all of them, but some of them will have the capacity to help you in the organising of the meetings, for example. There's an awful lot of administration and follow-up and communication that needs to be done to keep the momentum going. Your stroke support organisations can help you with this, so they could provide this role for you as part of this group and network. It's also really important on your committee that you have those officials who are responsible for change in your country. It can be at that minister level, it can be at regional level, however it works for you in your country. It's important you have these people on board. Italy, Estonia, Bulgaria, the UK, Portugal are some really good examples of this cross section of work and bringing all the key people together to make this happen. It's really important that we are collaborating, we are showing a united front, and that we're speaking with one voice when we're speaking to our politicians and our ministers. This is the feedback that we're getting from those countries that have had some success so far. What's next on their list of things we should be doing? Your fellow national coordinators are strongly recommending that you need to be clear about what the problems are in your country. What do you want to change in your country? And to understand that, these are some examples of what your fellow national coordinators and countries have done. So they have reviewed the Stroke Action Plan for Europe, which I'm sure you all have a copy of. They've reviewed this. Some countries, I actually haven't put on there, they've actually translated this into different languages. So if you do want to think about translating this into your language, and that doesn't exist already, it's something that can be done. So do make sure that you think about that if you want it to be translated into your language, because that can help you with your communication with your ministers. So review the Stroke Action Plan. So Ireland, over the last 5 years, their priority was about thrombolysis and acute units, and they've seen success in their countries by focusing on that in their country. Scotland didn't have any thrombectomy centres, but 2 new ones are about to open. Germany has reviewed the Stroke Action Plan. It's going to publish 3 position papers very shortly, which will tell us how stroke care is currently dealt with in their country and what needs to improve or change to improve patient outcomes. So it's quite interesting to use this to decide what you want to do in your country. The other thing you can do is to gather data from your own country. So Finland, for example, Finland has just asked its neurologists and key hospitals to gather data on the stroke services that are provided by those hospitals and also by the spoke hospitals in their regions. And again, I assume that this will also tell them how stroke care is dealt with in their country and what needs to change to improve. The other thing that I would, of course, strongly advocate for is that you understand what people think about living with stroke and having the stroke and living with the stroke, and asking them for their views on what it's like to live in your country with stroke. And the Stroke Association have done some really good work on the lived experience of living with stroke. They also did a great report during COVID. They've also done a third report recently around research priorities. And as you know, having read the Stroke Action Plan, there's a lot of research targets as well that we want to see happening to help us improve the Stroke Action Plan as well. So these are three suggestions as to how to gather the data that you need to understand what you want to change in your country. But what's really important is that you can't do it all, and you can't do it all now. So what you want to think about is what can you achieve in that short, medium and long term. And with that group, with the data, you should be able to set this out, because when you go to speak to your minister, you have got to be really clear on what your problems are, what your roadmap for solutions are, so that when you say to the minister, will you do this for us? You are really clear on what you're asking for. The declaration is a fantastic tool, but you need to be thinking about what do you want to see the minister achieving for you over that short, medium and long term. So the next top tip from your fellow coordinators is to get your voice known. First thing, send in the declaration if that's what you decide as a country and a group you want to do, send that in based on all the research that you've done and the committee recommendations. But once you've done that, what do you do next? Because it can sometimes take time for ministers to get to that point of declaration, but you've got to keep that momentum going. So you can do several things. You can think about raising awareness of the stroke issues in your country, and that the Stroke Action Plan for Europe is a fantastic solution that you want to see implemented. On European Stroke Awareness Day, we created a press release for you that I know many of you did use. And we got some really great feedback from Germany and Italy. They got a lot of publicity on European Stroke Awareness Day. And the Italians, I know, also got a lot of, they were able to do interviews as well on Stroke Awareness Day, based on the press release, based on the declaration, based on the Stroke Action Plan for Europe. And I know some of you will be thinking about doing this again on World Stroke Day, for example. So perhaps if you didn't do the press release on European Stroke Awareness Day in May, you might want to consider doing it again on World Stroke Day at the end of the month. And you can do a lot of promotion through Twitter, Facebook, newsletters on this cause. You might want to think about holding an awareness day, and it's European Stroke Awareness Day next May. So you might want to think about planning for that. Obviously, depending on what our COVID pandemic restrictions are by then, there are all sorts of places that you can hold awareness days anywhere. But just make sure you invite all the right stakeholders along, including the local press, to get them interested in this as well. Now, the final suggestion that I know has been suggested to several of our contacts throughout Europe is about making sure you're joining the debate in your country. So if your health minister or your social affairs ministry or are focusing on anything to do with health, it could be digital health, it could be research, it could be anything like that. These are really good opportunities for you to send in a briefing document and raise the profile of stroke in that area that the government is interested in. The other suggestion, which I know can be very challenging for us as a stroke community, but it is also worth considering joining forces or being involved in other top health conditions that your government is focusing on. Even though they say they don't want to focus on health conditions, they are. And Alzheimer's, diabetes, cardiovascular, neurology, it's worthwhile knowing what it is they're doing and what they're saying and where stroke could maybe fit into these opportunities. The reason that this is a suggestion is the more you talk about stroke as an issue, the more the government may hear it And the more they will hopefully decide, actually, this stroke needs a plan on its own. But unless we start to raise that profile at every opportunity you have, we won't be making that noise that our governments that we want our governments to hear. So do what you can, take all those opportunities to raise your voice. Now, this is my last slide of top tips you'll be glad to hear, but this is not an easy task. This is not something that will happen quickly. Change in terms of influencing advocacy and policy does take time. So keep communicating with them, keep communicating with those people that are responsible for change. And don't just think about working with the ministers, think about different people at different levels, at regional level, or that work within government that have an interest in health. Identify some champions, identify some ambassadors who will contact you to say, what do you want me to say about stroke? So do identify these. Organise Zoom meetings right now, that is what we're organising. And Bulgaria, I know, organised a fantastic meeting just recently where they had around 40 or 50 people on a call talking to the health minister from all aspects of that care pathway, including the stroke support organisation. And they are moving towards signing the declaration, but even more importantly, they're moving towards developing a stroke plan in their country. So this is great news, and it just shows what you can do when you have a group of people dedicated and knowing exactly what they want to focus on and what you can achieve. So I'm just going to finish off with one final slide for you. So in summary, don't give up. It's hard work. But I hope what I've been able to do is to show you that there are many countries out there at different levels of progress, but there are many countries out there that are getting things done. We're here as a committee to help you as well. And as Hannah said, we really want to hear from you this afternoon about what else can the committee do to help you with implementing it in your country. This is just a quick summary of those hints and tips that your national coordinators are suggesting you look at. As you can see, it's not an A to Z, it's not a linear pathway, it is circular. It is always thinking about, okay, we've now achieved part of our plan, what's next? What opportunities have we out there? Do we have all the right people on our committee? Keep thinking of it and keep reviewing it. So it's not an A to B, it's a circular thing. But most importantly, this work will give you your stroke plan. It will give you the funding. It will give you the audit. But most importantly, a reason for not giving up is because we want to see better outcomes for those people that have suffered stroke in your country. So just my final slide really is to say thank you for listening. If you have anything you want me to share or any questions of what I said today, please get in touch. And Hannah's going to pick up on this, but we do have some more meetings coming up over the next couple of months, and the ESO team will be in touch with you on sharing that information and dates with you. So with that, Hannah, I'm going to unshare my slide, I hope, and I will see you all very soon.
Thank you very much, Arlene, for this excellent talk. The next item on our program today is that we're going to go for the breakout sessions in the East, West, North, and South groups. And as usual, we will have like 1 minute to relocate, and then we will start the discussion according to the agenda.
Hello.
Welcome back, everyone.
Hello. Hello.
After the breakout sessions, I would like to walk directly into the breakout groups presenting the main points of their discussion. And I think we go north, south, west, east this time. So I would ask North to start presenting. Jannica, please.
Hello. We had a good discussion in the North group, and all the countries presented the work they have done, and we realized that there have been different scenarios, and some of the countries have been quite successful with signing already the declaration. The leader is Lithuania, of course, but there are also other countries in progress, and from UK and Sweden and Norway, they have concentrated mainly on other work. They have started with the healthcare professionals and already to implement the stroke programs. They have been quite successful. So and finally, we discussed on the support from the steering committee, and there has been suggestion to keep politicians engaged in the action plan, preparing the action plan implementation, and this is important in all countries because they have the power to decide what's going to happen in the countries. And also there was a suggestion for partnership from other societies, and also we stress that it is important to keep keep helping from the action plan steering committee to update and helping us how to make progress. And also a suggestion from Iceland to have connections between healthcare professionals and patient organizations in social media. So all countries have made a certain progress, but all countries have their own way. So, and Hanna stressed the importance of still signing the declaration in all countries.
Thank you very much, Jannica. And we will proceed with South. I do not know who will present the discussion or give the main point from the discussion in South.
Well, I will do it because in South we had not too many countries. Unfortunately, we had Ukraine, so we shared Ukraine with the North apparently, but it was very interesting to have Marina and Dimitri with us. So in the South room this time we had Greece, Italy, Israel, Ukraine, and Croatia. So we had a discussion of course, where we are and what are the tips for success. Greece highlighted the importance of mentorship, and this was also mentioned as a X factor for success by everybody, and also the importance of on one side of mentorship, national and international mentorship when assessing stroke issues with the Ministry of Health and stakeholders, but also the importance of data, of stroke epidemiology. Nathan made the example of Israel, where the registry data were really they were so important for the national government to start the action plan. Nathan also told us that they actually had already a declaration that was signed with different words, that was signed in 2014, which is in Hebrew, of course. It's in this office, so I'll ask him to send me a picture of this, because I think it's the pre-our declaration. I think it's really interesting to have that. Another interesting point, I think, tips is the importance of having on board the allied healthcare professionals. This was highlighted both by Nathan, the nurses, the rehab therapists, and so on, by Nathan and by Ukraine and Italy. Italy highlighting the importance of visibility through events, through press release. And Rosa Napolitano told us about how she was able to introduce the declaration and the action plan through her personal and professional contacts within the Ministry of Health and other relevant institutions. But I think what is a really practical idea we could take inspiration from is it's something that happened in Ukraine. They organized within the Ministry of Health itself a workshop, kind of workshop, where they invited the international mentors. Nathan was involved, and other people was involved. So they were in the Ministry of Health discussing stroke with the relevant MOH officers. And I think this was apparently was really key factors for success. So this also goes into the increase in visibility through events and mentorship. And so probably at the end, there's a multifaceted interventions are really important when trying to obtain both the declaration and both the national stroke plan. Croatia said something which is very interesting, according to me, is that once even when everything is ready, sometimes things seems to get stuck into the Ministry of Health. They have prepared a translation of the declaration. They have got everything. They collaborate. They are proactive. But even though the Deputy Minister of Health is a neurologist and the MOH is a neurosurgeon, still, the things are there. They take their times. This is the same in Italy, and so we know very well sometimes things are there ready, but then we need to scale up and implement. Thank you, and bye-bye from South.
Thank you very much, South. Then I would like West, and I'm not sure who is presenting for West to report.
I am Hannah.
Point. Hi, Bart.
Hello. Yeah, we had representatives from Germany, Poland, Portugal, Belgium, and Spain, and of course the last was dichotomized between Catalonia and the rest of Spain. And I must say that good progress has been made. As mentioned by Arlene, the declaration has already been signed in Portugal, and this will be signed in Catalonia shortly, actually this month, in a regional meeting. We've also noted, and this is one of the challenges, I think, that there are considerable differences between countries and regions with regard to the presence and the extent of national registries. And one of the major challenges is that if there are registries, that these are limited to intravenous thrombolysis and endovascular treatments, or at least to the acute phase. So these registries stop with having an MRS score at 3 months, and there's no information on the long-term consequences of stroke. Whereas, for example, in Catalonia, the focus of the plan will be on the long-term consequences. So there are actually little baseline data, and of course, this also applies to the published literature in general, of which I think 95% is on the acute phase. We think that ESO could support the process by first saying that we need registries, because if we say we need registries, then this helps the national organizations to establish registries and to say to their governments that this is important. But for example, also by writing a guideline on the care for patients in a more chronic phase. Of course, this will be difficult because of the lack of evidence. So it might be a very weak guideline, but at least this is something that could be considered.
Did you have a status on the declaration signing process in the countries that were represented, apart from those who have already signed?
I'm afraid Arlene should help me, but so it's been signed in Portugal. It will be signed in Catalonia. And I think the signing process is underway in the other countries.
Okay.
But no, someone may correct me if I'm wrong.
Thank you very much. And then we will go to East.
Hello, it's Valeria. Sorry, I don't have my camera on the computer, so it's not working. So we were, me and Robert Mikulik, we were together to chair this group, and we had representatives from Czech Republic, Slovakia, Hungary, Ukraine, Moldavia, and Armenia. And you know, we are already, let's say, for us, it's always something that we are used to discuss since the beginning of ISO East. So with the beginning of ISO East, we have already the rescue registry, where we have a kind of, no, we have already, let's say, some ideas what is going on in the country. So we know where we started in 2015. And where we are now in 2021. So in a way, we have a good mapping of the region. Clearly, in countries like Slovakia, Czech Republic, and Hungary, there is a good workup, let's say, setting for the acute stroke care. What happens now, and something that we see all over Europe a little bit, that after COVID, and all countries were challenged by COVID, I think stroke care, even in the highest, richest region of Europe, is not the same before and after COVID. And the biggest issue, for example, in the Eastern European countries is the rehabilitation and the life after stroke, because as said before, these countries like Czech Republic and Slovakia are extremely well organized. They have a strong network, so it's easier to build up a stroke system. Same what we're seeing, the same model is in a way applied to Moldavia. So they have a central plan from the state how to establish stroke units. For example, there's increase from 2 to 5. They have now all the hospitals identified, CTs are provided. They have new thrombectomy centers. Same in Ukraine. There's setting up of the infrastructure with the increase of TPA, but no, let's say, no long-term data on what this changes brought to mortality. A little bit a leitmotif is, I think, what is a little bit disrupting, and in Italy we have some idea of this, is, let's say, the frequent changes of the Ministry of Health. And Ukraine were very, very lucky. Our friends from Ukraine were very lucky to get the declaration signed on the last day of one of the Minister of Health. So we have to say, hello, great, this was wonderful. And we don't have to forget that in a country like Armenia, and we always want to forget this, there's still a war. And I think we have really to applaud our colleagues that I think they really need applause and a support from us, that they continue to maintain high levels of stroke care in their countries with planning where and how to establish new stroke centers and new stroke units. So what they ask, especially from Armenia, is a support from ISO to continue this setting up of stroke care in their countries.
Thank you very much, Valeria, for this report, which is also very positive overall. In spite of all the difficulties there are in different countries, progress is being made, and there's a lot of enthusiasm and a lot of people working at the same goals, which is basically to improve stroke care. Now we have time for a few questions or comments or other on the chat. So please, if there's anything you want to add to what has already been discussed, you might have had some new ideas on how the SAP-E organization can support you in your countries, or other comments, please come forward.
May I have a general comment?
Yes, please, Nathan.
Thank you very much. I think that from my experience, although you're focused now on these declarations, which is very important, but it was mentioned by Valeria. Some Ministry of Health are going and declaration stays, but this is the first step. Because it's very nice that you have the declaration and you are very proud of the declaration, but sometimes the officers in the Ministry of Health are very happy and they say, okay, we've signed the declaration. Thank you very much. And this is our achievement. Do not forget that you have to continue to work on the declaration, bumping on them every day. You have signed this declaration. We know from the NSD, the UN in 2011, Bonov and myself were there for General Assembly. 124 countries signed the declaration of the NCD declaration, but the WHO, few years later, have found that no country has actually implemented and followed this declaration, although it was signed by the ministers. So just to warn you, as Francesca said, we have a declaration in Hebrew signed in 2014-16, and it was an occasion of the stroke conference, and Michael Bryden was there, so he signed it as well. But it took us a lot of work to start implementing it. And, sometimes there's just a general comment that you don't pay too much attention just to the signing the declaration. You have to work further, very hard to implement step by step and take all the stakeholders to do it for you and with you.
Thank you very much, Nathan, for this sobering and true comment, but we still have to sign the declaration first in order to be disappointed by what happened afterwards. But you're right, but we have to move forward and we have to pretend that we think this will help. But no such signature will solve any problem, but it's just a little step on the way, but you're completely right. Any more comments? Because if nobody else have something to add, I think we should stop, even though it's 10 minutes early, but I'm sure that everybody have other things to do too. But if anybody wants to come forward, please do so. Otherwise, I want to thank you all for your great inputs. I think this has been extremely useful. I think that I have heard a lot of feedback, which will guide me and the other members of the SAP-E steering committee to improve our work. I think that I just want to state once again that you're always, or at least during daytime and evening time, welcome to contact us by email, directly or through the ESO secretary, if there's any way you think we can assist you. And if we can, we will be most willing. Of course, there will be things that we're not able to, but please contact us. We're available to assist. Just to remind you, as Arlene showed you, there has already been made dates for the next two workshops. The first will be on how to make a national stroke plan, and the last one will be on the stroke service tracker. On the 19th of October this month, there is a webinar which is not primarily aiming at our group who are already working with and involved in the SAP-E, but for everybody, especially members of ESO, members of SAFE, and others who are in the stroke area, where we want to inform them about what is happening in relation to SAP-E. I was told earlier today that there were actually already something like 300 participants who had signed in for this webinar, which is still more than a week away, which at least impressed me a lot and made me look even more forward to the event. So thank you very much for participating today. I'm very optimistic. I think I've heard a lot of good stories, and I think we're going in the right directions. But of course, it's a bumpy road, and we will not, get there by just wanting to go there. But I think we are doing a great work, each of us and all together. So thank you very much for today.
Bye.
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 Bye, thank you.
Bye bye.
Bye. Thank you.
Thank you.